Good day, everyone. Welcome to Black MD Head Show. And I'm Hayomide, your host for today. We have our doctor here, Black MD. Welcome, sir.
Thank you.
Yes, sir. So today we'll be talking about postpartum hemorrhage, which is bleeding after birth. So, doctor, can you walk us through what postpartum hemorrhage actually is in a short time?
All right, thank you very much. Postpartum hemorrhage is bleeding after childbirth. Now, childbirth through normal delivery, called spontaneous vaginal delivery, if you have a patient losing about 500 ml of blood after childbirth by herself, which is a spontaneous vaginal delivery, or you have bleeding of about 1 liter or more of blood after a cesarean section, that is what is called postpartum hemorrhage. It's called postpartum because bleeding that happens after delivery. So if the delivery comes through that's normal SVD, vaginal delivery, that's more than 500 mils, we call that postpartum hemorrhage from spontaneous vaginal delivery. If it is losing 1 liter of blood after cesarean section, it is still postpartum hemorrhage, but the difference is the route of delivery. That's why the volumes are different.
Okay. Then why don't more people talk about this PPH, even though it's one of the most causes of maternal complications and deaths?
Yes. Well, I think people are not so knowledgeable about the term postpartum hemorrhage. What they'll tell you is, let me say that in Yoruba parlance, they will say internal bleeding, only internal bleeding, So that's the reason. So it's not that they are not aware, but they don't really talk much about it. And that's because it is purely a clinical diagnosis, and it happens most times within the hospital environment. Because if somebody delivers by herself and then goes back home and now starts bleeding, you know that, which is one of the reasons why we can't tell at this juncture. Allow me to tell you that delivery, when you have your baby, if it is a vaginal birth, please wait in the hospital for 24 hours before you go home. Reason is because you want to watch out for primary postpartum hemorrhage, which is the one that comes within 24 hours of birth. And that is it. People talk about it, but they don't actually know that that is what is called postpartum hemorrhage. Whether through a vaginal birth or through cesarean section, postpartum hemorrhage is one of the leading causes of maternal mortality, and it is a topic that must be visited from time to time.
Okay, doctor. As an healthcare personnel, how do you get to know about this PPH? Is it through research, personal experience, or through your patient?
Thank you very much. I was taught in school, okay, so kudos to my teachers, okay. So we had ONG posting, obstetrics and gynecology, and during that period, we talked about labor, fantastic lecturers putting us through labor and then delivery itself. That's why we talked about vaginal delivery, SVD, we were taught about cesarean section. Then shortly after, the lecture that followed was postpartum hemorrhage. So in school, yes, we were taught. After school, even as an intern, you will experience it. Imagine seated and while trying to catch your breath. Now, the doctor's call is majorly 24 hours call. Okay, so after the work of the day, you're trying to catch your breath. You run antenatal clinic, and then you're trying to catch your breath, and then next thing you hear screams and shouts, a woman is rushed in, and it might be somebody like you met in the clinic, and this woman just put to bed and she just went home, and the next thing they tell you she's bleeding, and she's bleeding profusely. So aside from in the lecture room, in the emergency room, we get to meet with them, and that is where we get to make the diagnosis. So it's basically through the teaching and through experience on the field, emergency experience on the field.
Okay, so doctor, I want to ask again now, what are the causes of PPH?
Thank you very much. Now, postpartum hemorrhage, I would want to say the commonest cause is called uterine atony. What is uterine atony? When the uterus expels the product, which is a live baby and the placenta, the uterus is expected to go back to its form as before. Now, when the uterus takes in, it grows big, and then having grown, it gets the baby in. And then after delivery, uterus is expected to go back to its form. So when the uterus fails to go back to the form where it was before it became pregnant, that means it has lost its tone. not able to contract itself, that's uterine atony. That's a major cause of postpartum hemorrhage. Another is retained products of conception. When there are retained products, probably placental tissues, fetal membranes, and so on and so forth, these things will continue dropping blood, and that can also cause postpartum hemorrhage. Another is trauma to the uterus. When you say trauma, either uterine laceration or uterine rupture. In a situation where you have any of these, it can lead to postpartum hemorrhage, because if the uterus is torn, the uterus is always heavily supplied with blood. As a matter of fact, a heavy uterus that is laden with term baby can weigh as much as 11 kilograms. Meanwhile, the baby that comes out is weighing 3 kg. What's the remaining? The blood and the tissue that has expanded. So, looking at that, if that uterus happens to be torn in any way, bleeding is going to be torrential. The last is if the patient has blood clots or clotting disorders. So if they have clotting disorders, that means the blood is not able to clot, like thalassemia, like bleeding disorders, bleeding diastasis, like we call it in the medical line. These, in a nutshell, are the 4 most common causes of uterine postpartum hemorrhage, rather, which can really affect a woman after birth.
So does that mean that this PPH has nothing to do with the patient's lifestyle?
Patient lifestyle is not so involved unless there is an issue of trauma, like accident or a fall. Yes, if a pregnant woman falls or accidents, or probably a pregnant woman goes in on a drinking spree and in the process loses her balance and falls. So trauma still comes in. But lifestyle as it were may not put the person in trouble, but if the lifestyle were to now put the person in harm's way, then that can be involved.
So as a doctor, how do you tell the difference between normal bleeding after birth and PPH?
Thank you very much. It is by volume. But as the placenta is coming out, a volume of blood comes together with the placenta. That's expected. Now, you clean the person up, you explore to bring out all clots and all form of items. You clean out the membranes, both placental membrane, fetal membranes, give your medications, and then you clean up the patient, ask her to take a shower, go and lie down on the bed. Now, delivery is done. You study the placenta and be sure that the membranes are complete. And then the baby is fine. Baby is by the cot, by the mom, everybody's calm. And suddenly after, patient starts bleeding. And the bleeding, you can quantify up to 500 ml if it were a vaginal delivery, or up to 1 liter of blood if it's through a cesarean section. If this happens just in the line of how I have described it, you will by that time make your assessment of postpartum hemorrhage, PPH.
Okay, then let's talk about the early warnings for pregnant women to look out for. Early warnings.
Early warnings to look out for. Well, the funniest thing is that with postpartum hemorrhage, it is only an event that happens after birth. So where the early warnings will come in is if you are having an antepartum hemorrhage, which I believe is a topic we would likely talk about for another time. The only advice I'll give pregnant women is this: when your pregnancy is in the 3rd trimester, I do not counsel women to travel. I do not counsel women to stand for too long. I do not counsel women to wear high heels. I do not counsel them to get involved in situations that will put them at risk. Yes, so those are the things I would rather say. Let's warn them to be careful, because getting involved in road traffic accident can cause doom for them. So I think we should just be careful with movement and everything concerned.
Okay, then we are still talking about the PPH.
Okay.
Is PPH common in vaginal delivery, C-section, or it doesn't matter?
It doesn't matter, but I have seen them commoner in cesarean section. It's commoner in cesarean section. I've seen in vaginal delivery as well, and let me say from what I have seen, those that I've seen in vaginal delivery are due to uterine rupture or retained placental tissues. Then in C-section, a lot of things can be involved. You know, there was a reason why that surgery happened. So that reason in itself can predispose that person to PPH. Whichever way it happened, PPH is something that is dreaded by every obstetrician and everybody involved in caregiving of the pregnant woman and the birth. It must be prepared for even before delivery. It must be prepared for.
Okay, so in dealing with PPH, what are the challenging things to look out for?
Well, the challenges of PPH are enormous. One, time. Time is not your friend. Time is not your friend. Once you have a PPH, I remember, shout out to my teachers again, first thing they would tell you is shout for help. Yes, you can't manage PPH alone. So you need more hands. You need more people to think for you. While you're trying to secure IV line, somebody is thinking of what is the blood group of this person, especially the person put to bed in your facility. Somebody is checking up, what is the blood group? Someone is quickly checking, is this patient pale or not? And then they are quickly making arrangement for blood if need be. While the other person is now setting up where you want to explore, because you may need to explore, go back and check any blood clots, any retained products, what is it that could be. So the challenges are enormous, but time is your friend, is not your friend. So while talking about time, the personality, all this someone should do. It is people that are competent enough to do that will. If they have to wait for you to give all the information, you are just there all by yourself. You may lose that person by the snap of a finger. So the challenges of PPH are one, time of presentation. A lot of times patients come late. The woman would have bled out, what I used to call ensanguination. They would have bled out. They may have entered the irreversible shock from bleeding so much that the uterus becomes completely flaccid like paper and doesn't respond. We need to put all these things in perspective. Also, having the right personnel at every given time. Number three, having basic things available, such as access to blood and blood bank, access to IV cannulation, IV fluids, and everything that is needed. If you are running a facility or you work in a facility that takes delivery of babies, you must have in that facility medications that will help to control uterine bleeding. Okay, you must have them available. It's not a scenario whereby you are taking a delivery now and the nearby place to get medication is 1 kilometer or 2 away. That will spell doom for the patient. Let's just stop it because we have quite a lot of things to talk about in terms of concerns.
So how does PPH affect new mom, like mentally?
Yes, postpartum hemorrhage will, of course, at the end of the day, when you are able to control the situation, you are glad you have saved the life. Yes, most times they have to manage with the low blood level left, even after multiple transfusions. We've had them come with still low PCVs. It might take a while before they adapt. And with that low PCV comes weakness, tiredness, poor sleep. They may not even be able to breastfeed the baby as they would want to. They will still even be needing attention themselves to be nursed. So they themselves will take a while before they recuperate back. The baby may not be well taken care of as at that time, especially if they don't have enough hands to help them in nursing. And good food availability is also an important factor. A lot of proteins are needed for a woman who is recovering from anything related to delivery. A lot of foods, Yoruba will call them the ewa, eja, ede, ẹran, ẹ̀fọ́. All those protein foods and then vegetables and co are necessary, and these things come at a price. So getting them available is also important. So rehabilitation of patients who have survived from PPH might take a while, but persistence will get them back on track.
So speaking of more hands,
Yes.
how can relative partners help the PPH person?
Thank you. Number one is your presence, availability. If possible, be there when your wife is put into bed. If possible, that's why I said if possible, you'll be there when your wife is put into bed so that whatever it is that is needed, you can also help in procuring it. Now, number two, the moment she gets back home, that's not the end of your work and your help. You should help out with the kitchen work. Well, if you are listening to me as a man and you don't know how to cook, if your wife is pregnant, learn. Okay, before she takes in, learn how to cook. Okay, just learn how to cut the yam, peel the back, cut it, wash it, put it inside the water, put a little salt, put it on the burner and monitor it. If you don't know how long it will take for the yam to be boiled, then sit in the kitchen and every 5 minutes you check it. You will just learn it. And then let her put you through, learn how to cook so that when she's back home, while she's still trying to gather her energy, you can help by making food for her to eat. That way, you are passing a message across to her. You are with her for the good and for the better and even for the bad if it comes. So every spouse, every relative should be available until she is able to do all those things by herself. She shouldn't be left alone. Let's not forget Probably one day we'll talk about it. Puerperal problems, okay? Puerperal psychosis, puerperal blues, puerperal depression. The topics are endless, things that we need to look into regarding the life of pregnancy or pregnant woman after birth. She's left with a baby. What will she do with that child?
And so, doctor, a lot of people are not aware of this PPH of a thing. So, how can we improve awareness?
Thank you very much. Now, PPH, I would rather say, is not meant majorly for the listeners. It is meant majorly for the health team. Now, the aspect where our listeners need to know is that if such occurs, you have a role to play. Roles such as providing the logistics in terms of funds and movement if need be, funds to procure medications, funds to procure blood if need be, funds to procure IV fluids if need be. So your knowledge is to know that such can occur. So if it occurs, we need you to act fast in making those things available. And then, yes, because at that point, the woman has no even decision by herself to make. So your decision will even contribute to a large extent to save her. And at this juncture, allow me to say, please, when PPH happens, you don't go screaming and shouting at the health team. Nobody wakes up and plans to go wicked a woman. Nobody wakes up and plans to go affect somebody negatively. PPH can occur even after you have done everything necessary. Even after the uterus, I know of a person, thank God she's alive today, still taking care of her kids, who had a cesarean section due to twin gestation and breech presentation. So in her own case, she suffered what is called uterine overdistension, and that led to PPH. Today, she's alive to the glory of God. The womb had to be taken out because that was the only way that blood could stop. Now, in that case, do you go blaming the health team? No. The surgery was performed properly. By the time the situation was x-rayed, at the end of the day, it was found that it was overdistension, which is not the doctor's fault. Overdistension means that the uterus was too distended because of the weight of the babies and couldn't contract back. That means the tone could not be restored. So the part that you should know is that if it happens, it has happened. Then provide every necessary logistics so that the health team can effectively administer and the life can be saved. Remember, if a child dies, it is that child that died. If a mother dies, you have lost a generation. So let us work hand in hand to prevent PPH from taking any mother away.
Okay, so Black MD,
Yes.
I learned that PPH patients, they are always traumatized after they've gone through that. So how can we support them?
Thank you very much. I hope you know that simple word of comment or compliment rather goes a long way. Having undergone PPH, you pass compliments to say, oh, you are doing well. Your blood is building back. You're getting better. I can see that you're moving. Oh, that's good. You're doing well. The comments and the compliments will help them psychologically. While their body physically recovers, their psychic is better off because they believe that, yes, our doctor said I'm doing well. Oh, I'm doing well. And they're happy about it. So it is a concerted effort to help them. While we talk about the physical response, we also talk about the psychological response so that they can be integrated back into the community.
So apparently we should encourage them.
Yes, we should always encourage them. It's not an easy task, but it is possible.
Okay. So as we're wrapping up, I want to ask that if you could leave listeners with 3 keys about PPH, what would they be?
3 keys. Okay, I'll just say, let's stay healthy. Number 1, visit your hospital and be regular with antenatal. That's the way I want to approach it this time. Be regular with antenatal, because if you are pregnant and you are carrying a 4.5 kilograms baby, and the baby you had before, if that was your second, was a 3 kilograms, you already have a fetal macrosomia. If you are attending antenatal regularly, you must have been informed about that, and then you will be told of things that may occur during labor. Okay, so if you are attending antenatal regularly, you will be prepared both physically and emotionally and psychologically to face whatever happens after. So 1, attend antenatal regularly. 2, follow instructions. very, very well from time to time. 3, let your antenatal sessions be an engagement. You ask questions from your physician, get to know things, ask questions, be free, because the more you ask, the better you learn, so that you can also be involved in the caregiving as it goes on around you during your delivery. I wish every pregnant woman a safe delivery, happy mother, happy child, and a grateful medical team. Thank you very much.
Thank you very much, Black Indy, for having me on the show today.
A pleasure.
So we'll see you next time. Bye.